Hello everyone. Today we'll discuss about a topic that is anti-tubercular drug. So what is tuberculosis? Tuberculosis is a chronic granulomatous disease which is basically affects our lungs, especially the lungs alveolus. Okay. So this is basically caused by a bacteria that is Mycobacterium tuberculosis. This bacteria basically causes type 4 type of hypersensitivity reaction in the lungs. Okay. Type 4 type of hypersensitivity reaction in the lungs that leads to activation of alveolar macrophage and causes symptoms like apnea, sneeze, apnea, fever, change. Okay. So it is the one of the deadliest disease in the developing country because it affect India. It affect many people, and India has the highest number of TB cases. Okay, so if we'll talk about drug, we have two type of drugs, two type of anti-tubercular drug, that is first line and another one is second line. Okay, how you will distinguish between first line and second line? First line drug having high anti-tubercular action and low toxicity. ओके इन लोगों के पास हाई एंटी ट्यूबरकुलर एक्शन रहेगा एंड लो टॉक्सिसिटी रहेगा एंड ये उल्टा होगा सेकंड लाइन दैट मीन्स लेस और मॉडरेट एंटी ट्यूबरकुलर एक्शन with high toxicity. Okay, let us come to the classification. Okay, so according to uh, first line and second line drugs are classified like फर्स्ट लाइन ड्रग. सो फर्स्ट लाइन ड्रग्स में हम याद रख सकते हैं रिप्स. ओके, रिफाम्पिसिन, इसको शॉर्ट में हम आर लिखते हैं. आइसोनियाजिड, इसको लिखते हैं शॉर्ट में एच. पायराजिनामाइड, इसको शॉर्ट में हम लिखते हैं जेड. इथाम्ब्यूटॉल, इसको शॉर्ट में लिखते हैं ई. एंड स्ट्रेप्टोमाइसिन. Okay, these are the first line drugs. So what are the second line drugs? तो सेकेंड लाइन ड्रग में कौन कौन सा ड्रग आता है? सेकेंड लाइन ड्रग में आते हैं ड्रग्स लाइक इथियोनामाइड, देन प्रोथेनामाइड, okay, third cycloserine, fourth one is perizidone, then para-aminosalicylic acid, rifabutin, thioacetazone, then fluoroquinolones like LMCO, levofloxacin, moxifloxacin, LM, LMCO, ciprofloxacin, and last one is ofloxacin. From this among four, levofloxacin having it is more potent. Okay. Other than that, some aminoglycosides are used. Some aminoglycosides are used. These are basically injectables. Okay, like kanamycin, amikacin, and capromycin. Okay, then let us discuss about individual drug. Let us start from isoniazid. Okay, here I will discuss the important point that basically that the point that important for the exams. That point I am gonna discuss. Let us start with isoniazid. Shortly we write it as INH or simple H. Okay, so this is a tuberculocidal drug. Tubercular cidal drug. Okay, second important point is effective in extracellular as well as intracellular TB. Intracellular means the bacillus, the tubercular bacilli present inside the macrophage. Okay, it is effective in both acidic and basic medium. Okay, if we'll talk about its mechanism of action, it inhibits the mycolic acid synthesis. What it is done? It is do is it is helps in inhibiting the mycolic acid synthesis. So what is mycolic acid? Mycolic acid is an important component for the preparation of cell wall of this microorganism. How this drug basically act? It inhibit the mycolic acid synthesis by inhibiting two important genes. By inhibiting two important genes, that is INHA and KSAA. These two gene is inhibited. Okay, so this is the one of the important important component of the Mycobacterium cell wall, that is mycolic acid, which is basically inhibited by the isoniazid. Okay, so if we are talking about the pharmacokinetics, it is well absorbed orally. Okay, so its metabolism metabolized by N-acetylation. Okay, metabolized by N-acetylation. So its metabolism is affected by fast acetylator and slow acetylator. Its metabolism is fast acetylator and slow acetylator. So what is fast acetylator? What is slow acetylator? Let us know that 30 to 40% of Indians are fast acetylator and 60 to 70% of Indians are slow acetylator. So what do you mean by fast acetylator? Fast acetylators are the category of people. They are metabolizing the metabolize the drug isoniazide in a fast rate that leads to decrease the activity, or we can say that decrease the duration of action. Slow acetates are slowly metabolize the INH metabolism and increases the duration of action as well as the toxicity. Okay, in case of fast acetylator, T half of isoniazide is around 1 hour. In case of slow acetylator, around 3 hours. Okay, then come to its adverse effect. Its adverse effect is very much important. First, most topmost adverse effect is peripheral neuritis. Peripheral neuritis, hepatitis. Okay, these two are the hepatitis due to hepatotoxicity, that is the destruction of the hepatocyte of the liver. Okay, other complications, other complication like it can causes neurological symptoms, neurological symptoms. Okay, so the peripheral neuritis is can the peripheral neuritis condition of the isoniazide can be treated by pyridoxine. That it's in a dose of 10 mg per day. Okay, the peripheral neuritis condition of the due to isoniazide can be treated by pyridoxine in a dose of 10 mg per day. Okay, if we will come to the drug interaction, the point I am highlighting here is very much important. So please try to remember. First INS drug interaction is with aluminum hydroxide. If we will combine aluminum hydroxide with isoniazide, the absorption is inhibited. Inhibition of the isoniazide absorption, because aluminum hydroxide reduces the absorption of isoniazide by forming chelates. Second important drug interaction is if we will combine isoniazide with para amino salicylic acid. Okay, what it is do is para amino salicylic acid inhibits the isoniazide metabolism, so increases its T half. T half is increased. Okay, third it important point is as it is a enzyme inducer. Okay, it is a enzyme inducer, so it can metabolize, it can increases the metabolism of following drugs. Increases the metabolism of the following drugs like, what are these drugs? Drugs like phenytoin, sorry, it is not a inducer, it is a inhibitor. It is a enzyme inhibitor. Okay, it decreases the metabolism of phenytoin, carbamazepine. Okay, decreases the metabolism of phenytoin, carbamazepine, warfarin, theophylline, and increases its toxicity. Okay, let's come to the next drug, that is rifampicin. Okay, rifampicin. Rifampicin is a semi-synthetic derivative of rifamycin B. It is a semi-synthetic derivative of rifamycin B. Okay, semi-synthetic derivative of rifamycin B, and and from obtained from and it obtained from a organism, that is important, Streptomyces mediterranea. Okay, this is a bactericidal drug. It is also like isoniazid. It is effective in both cellular as well as intracellular bacilli. Its mechanism of action is very much important. It's act by inhibiting RNA synthesis. Okay, how it will inhibit? By blocking DNA dependent RNA polymerase. Okay, by blocking DNA dependent RNA polymerase enzyme. Okay, so it is also absorbed orally, but food decreases its absorption. That's why rifampicin always taken in empty stomach. So always taken in empty stomach. Next important point is it is a microsomal enzyme inducer. It is a microsomal enzyme inducer, and we know that when once drug induces microsomal enzyme, it decreases the duration of action of a particular drug. So these drugs are like warfarin, corticosteroid, okay, corticosteroid, oral contraceptive pills. So it causes oral contraceptive pill failure. Okay, drugs like NRTIs, nucleoside reverse transcriptase inhibitor, then NRTIs, reverse transcriptase inhibitor, drugs like phenytoin. Okay, such class of drugs metabolism increases, that leads to decrease in duration of action. Second important point is it is a autoinducer. Autoinducer means It can also increase its own metabolism. Okay, if we will talking about its adverse effect, if we will talk about its adverse effect as hepatitis. Okay, second important adverse effect is jaundice, then flushing, orange red color urine. It is a typical one, so it is important. Orange red color urine is typically seen in rifampicin therapy. Okay, other symptoms like shock renal failure can also seen. Okay, then third important drug is pyrazinamide. Shortly we call it as Z. Okay, those points are very important. I am telling you, it is activate in case of intracellular bacilli only. Second important point is active in acidic medium. Only active in acidic medium. Okay. Then what is its mechanism of action? It is quite synergized to isoniazide. So it acts by inhibiting mycolic acid synthesis. Okay. By blocking fatty acid synthesis. Okay. It inhibits the fatty acid that ultimately inhibits the mycolic acid synthesis. Okay, so it is quite important in meningeal TB. It is useful in meningeal TB, that is TB in brain or meningitis. It's in that condition it is effective. Okay, so important side effects are hepatotoxicity. So most of the antitubercular drugs are hepatotoxic in nature. Hepatotoxicity, which is dose dependent adverse effect. Dose dependent. Okay, second adverse effect is hyperuricemia. Then hyperglycemia. Then abdominal distress. These are the important adverse effects associated with pyrazinamide. Okay, then next important drug is Ethambutyl. Next important drug is ethambutyl, shortly we called it as E. Okay. So ethambutyl is a one of the important drug and it is a tuberculostatic, not cetal. Okay. Tubercular static. It is effective against Mycobacterium avium complex. It is effective against Mycobacterium avium complex. Okay, its mechanism of action is quite different. That it acts by blocking arabinosyl transferase. Okay, it acts by blocking arabinosyl transferase, which that synthesis that synthesize arabinogalactone. Okay, what is this role of arabinogalactone? So ये arabinogalactone का क्या रोल है? It helps in arabinogalactone helps in incorporation of mycolic acid to the cell wall. ओके जो माइकोलिक एसिड है जो ये क्या करता है ये सेल वॉल पे इनकॉर्पोरेशन करने के लिए ये अराबिनोगैलेक्टोन का जरूरी है. सो आज अराबिनोगैलेक्टोन सिंथेसिस इज इनहिबिटेड बाय इथाम्ब्यूटल. द इनकॉर्पोरेशन ऑफ दिस mycolic acid is decreased and that leads to death of the microorganism. Okay, so important point is it's an important side effect that seen is optic neuritis. So important adverse effect are optic neuritis, hyperuricemia, optic neuritis, and remember that optic neuritis is dose and duration dependent. Okay, it is dose and duration dependent. Then hyperuricemia, and one thing you should remember about this is it is safe in pregnancy. Okay, other drugs that can be used in the tuberculosis are like kanamycin. Kanamycin is a aminoglycoside. If we'll talk about kanamycin, kanamycin is a aminoglycoside antibiotic. Okay, it is effective in case of effective in MDR-TB, that is multi-drug resistance TB. In case of multi-drug resistance TB, kanamycin is effective. Okay. Next important drug is ethionamide. Next important drug is ethionamide. It is having similar action like isoniazid, that is inhibit the mycolic acid synthesis. Isoniazid के जैसा ये काम करता है. Okay. Okay, it having a very serious side effects like hepatitis. Side effect having more side effects, hepatitis, then metallic taste, metallic taste, anorexia, hypersensitivity reaction. This hypersensitivity reaction is basically due to presence of sulfur in their structure. In the ethionamide structure, sulfur is present. Due to that hypersensitivity type of reaction. Another important reaction that related to sulfur is, that is, it causes sulfurous bleaching. It causes sulfurous bleaching. Then other side effect are menstrual irregularities, and goiter. So its uses is very important, that used only for MDR-TB और ड्रग रेजिस्टेंस ट्यूबरकुलोसिस के केस में ये इसका यूजेस किया जाता है. ओके. Then these are the uses and different type of drug that can be used during tuberculosis. Hope everyone understood the antitubercular drug, and the next video we will discuss about anti-leprotic drug. Thank you.